Hi, this is Dr. Shiroko Sokitch from Heart to Heart Medical Center, and I am going to explain to you your hormone test results. If you're watching this video, you have most likely done the hormone test. And the Dutch hormone test, and I'm going to be explaining to you how the results work and what it looks like so that when you come in for your visit, you'll be prepared. So again, I'm Dr. Shiroko Sokitch from Heart to Heart Medical Center. And here are the things to keep in mind. This is for you if you're a patient of mine, an explanation of how your hormone tests are interpreted when you follow up your visit. And if you have questions, please write them down so that when you come in for your follow-up, you will be prepared. So we're going to start with this little map here. All of your hormones are made from cholesterol. And this is an overview of how the whole system works. So all your adrenal hormones are made from cholesterol. Pregnenolone is the first hormone. Progesterone is second. And you see how these little arrows are all pointing in direction, right? So every single one of these arrows is a step in hormone production, and everything kind of follows a chain reaction. So from this goes to this, goes to this, goes to this, goes to this, goes to that. And you can see that these arrows move all across. So the reason I show you this is so that you can, first of all, see that everything is connected. And second of all, that you can see that one step leads to another so that nothing is in isolation. And that's how I treat you, that I keep in mind that everything's connected so that everything can be as balanced as possible. So you go from progesterone, you go over to making various estrogens, and you also go down to make cortisol. Cortisol is your stress hormone. Cortisone is the inactive form of the stress hormone. And then there's all of these metabolites of cortisol. And metabolites just mean that cortisol goes on to make all these things. And then you go over here and you see DHEA. And DHEA is metabolized down into androsterone and etiocholinone, these two things. And testosterone is metabolized down. And there are two pathways of metabolism, which I'm going to explain in a little bit. And then you can also see that there are 8 different estrogens. So all of that will also be explained in the next few slides. So just keep this photo or this slide in mind as you think about all the individual tests. So on the first page of your hormone testing results, you'll look at here and you'll see this little diagram. This is a summary. So all of the individual numbers are added up together. So 8 different estrogens, 2 different progesterones, 3 different testosterones, all added up together, okay? This is obviously not your result. This is just an example. And so the normal range of a woman who is cycling is from star to star, okay? And for a man, this doesn't count. If you're a man and you're watching this, from star to star is your normal range. You don't have a menopausal range. For a woman, this little area here is the only with estrogen and progesterone, but this is the postmenopausal range that's normal, okay? So here's the total estrogen, and from star to star, again, is the normal range, and for a cycling woman, this would be in the normal range, okay? And then you're looking at progesterone from star to star, normal range, menopausal range. So this progesterone level is a little bit above the menopausal range. And you can see that the testosterone level is quite low here, the normal range being from star to star again. And then again, this is a summary of everything. So DHEA, the summary of total DHEA, 400 to 2500 is the normal range. And then here is the cortisol pattern. So the black lines represent the normal range. Again, there's not a menopausal range for this. And the red line represents the patient's range or your range. If you're looking at your own test results, this is your range, okay? And then when you add all that up together, it represents the total for this person. The total of the cortisol levels are fairly low. But the cortisol, and this is what's different from saliva testing, the cortisol level is metabolized into other things. And you can see that her metabolism of cortisol is pretty high. So there's something going on here where even though this is low, this is really high. Then we go to the second page, and I usually ignore this page. There's a second and third and fourth page that are just lists. And the normal range that they show is premenopausal ranges. So this is almost useless because the next page shows the little diagram. And so here, this is progesterone metabolism right here. And there are the two main progesterones. This one is the more active. So this is the one you want to have more of if you're using progesterone. Now, if you're using progesterone cream, this reading may not be accurate. So kind of the combination of how you feel and what the actual level is will show up. If you're taking it orally, it will show up here. So it just kind of depends. So you can see that hers is in the sort of semi-low normal range, slightly above menopausal range. And then DHEA, normal is 23 to 350, and there's the range of normal again. And so it's on the low normal side. And then testosterone is really low. So the DHEA is not being converted into testosterone here. And then you look down, this is the metabolism of DHEA. So this goes from here down to here, right? And then there's the red and the blue. Now, blue is called 5-alpha reductase, and that's an enzyme that breaks down DHEA and testosterone. And what's interesting is this test is so great for looking into the window of your body. But the 5-alpha reductase is the more masculine metabolism of these hormones, okay? So if you have a tendency to go in the more masculine direction, there's several complications of having more masculine testosterone. One is that you're more prone to being insulin resistant, which is a pre-diabetic problem. And you're more prone to various other complications of too much testosterone, even though you may not have a high testosterone. And then if you get in the red zone is less masculine. And ideally, you would be kind of balanced in between. And all of this stuff can be balanced. So like if you have a tendency to go in this direction, you would take zinc and saw palmetto, and it'll push you in the other direction. So it'll be less masculine. So, and then the next section here is how estrogen is metabolized. And so this is, again, the main different estrogens that we replace. So estrone, estradiol, estriol are the main estrogens that we give in replacement. And this person is taking estriol, so it's a higher level here. But the star to star, again, is the cycling range, not the menopausal range. And then these are broken down into blue, red, and green metabolites. A normal woman's metabolism of estrogen looks like this. So there's green, red, and blue, and it's sort of in a balanced state, right, in this sort of percentage. And this person's estrogen metabolism is actually slightly better than the normal person's, more prone to or less prone to make red and green, or red and blue. And red and blue are they're more complicated, like if you have more tendency to have red and blue, then you're more prone to be making estrogens that aren't balanced. And then you want to actually push that in another direction. And again, certain supplements and nutrients will push it more toward the green. So you want more green. So you see down here the final step, 2-hydroxyestriol. So that's why estriol is given a lot, because it's unlikely to make any of the blue or red, so you have more green, and it'll metabolize straight down into the green. And then from here to here is the final step of metabolism of estrogen. And this is called a methylation step. And so this is the final step of processing estrogen, but methylation is an important step in your whole body. Methylation is one of the pathways that the liver uses to detoxify things. And there are people who have genetic imbalances that don't allow them to do this. And this person does. You can see that she doesn't methylate very well. And again, this is something that can be changed. You can just take the right supplements and it'll change that. So, all of this information is useful because we can use it to make you more balanced and to help your body be more healthy and to help it work in a more functional way. So if this person isn't able to methylate, you can look at the methylation pathway and you can see what supplements need to be taken in order to help it happen. And this is a big, complicated explanation, which at some point, if you're more interested, I will create a video for that. Okay, thank you. So next, then the fourth page is another list with numbers. And this slide actually shows the same thing. And I like pictures, so I usually just ignore the lists. So this is your brain on stress. So stress comes into your brain. It affects your hypothalamus and your pituitary and your adrenals. So it's called the HPA axis, hypothalamic pituitary adrenal axis. So again, this is another representation that everything communicates. Melatonin is what they measure on this test. Melatonin is made from serotonin. And so if your melatonin is low, it's likely also that your serotonin is low. And there are many things that affect your melatonin levels, including computers and computer bright lights and things like that. But so if your melatonin's low, that might affect your sleep. So this is one of the areas where if you are having sleep problems, you might notice that you could have an impact on that. And then you're looking at the DHEA. And again, this is the total, but you can see that the DHEA is on the low side and that cortisol metabolism is on the high side. So the cortisol metabolism is high, even though the cortisol numbers themselves are low. Now, DHEA balances cortisol. So this is a thing that if this is really low and this is really high, that a person could feel wired and tired at the same time. And so, like there's so much information here. You can just, see what is out of balance and then figure out how to get it more in balance. And then what's cool, another thing that's cool here is that it shows the cortisone levels versus the cortisol levels. Okay. And for this person, the cortisone levels are actually a little bit higher than the cortisol levels. And, so that means that the body has a tendency to make cortisone. And this is where a person could have high belly fat. If you have a higher preference for cortisone, you might have more belly fat, and you can push that by using certain supplements. You can push it in the direction of cortisol and in the direction of more balance. The next page is a similar to the first page, except that this is made by the Dutch people and the people who do the testing. And you can see that there's a lot of information here. And again, it shows how everything's connected. But what else it shows is that how your body metabolizes things. So the things that push the metabolism and how it works, so like progesterone. If you're more prone to making the beta pregnenolone versus the alpha pregnenolone, you have more various symptoms. And then it increased cortisol, stress, inflammation, Cushing's, decreased cortisol, glucocortisol, there's all these different things. Increased DHEA, low DHEA, increased testosterone. And what are the causings? A lot of, I show it to you because it's a part of the results that you'll get. And if you see this before, you're very welcome to look at it more closely. Like if the cortisone, if you have more cortisone, it might be because you have too much thyroid, or if you have poor quality sleep. And if you want to push it toward cortisol, might be hypothyroid, and you might have inflammation. You might have more belly fat here. And how you metabolize it also shows something. So again, there's a lot of information here. And usually when we go over this test, I do not spend time looking at this, but this is for your own information. You will receive this when you get the call. And then here, the last section is the provider notes. And there are many pages on the provider notes. And I just want to show it to you, just one little section of it. It's called provider notes. And it'll show there's a lot of explanation here. So like here, it explains how the urine test works and how progesterone metabolism is done. They'll explain this for every element. And then anything this is all generic explanation, the thing that's in normal type, but then anything that is in high, all caps is about you personally. So if you read this, and most of it is just information, but you can then understand what might be going on there. So that is a preview. And when you come in for your visit, what we'll do is we'll go over your results and we'll see how they all tie into how you're feeling. How we treat is that I take this information, not just the numbers, but how you feel, and I use it in order to help you understand or help you feel better. The whole idea of the testing is to take the information and interpret it according to how you feel and then help you get balanced and feel better. And we keep the whole picture in mind. We don't just look at the individual numbers. We look at how the whole system works together and work to get it balanced. Okay, I'll look forward to seeing you on your next office visit, and I hope you have a wonderful, wonderful day. Take care. Thank you.